Today we'll talk about World Myeloma Awareness Day. So what is multiple myeloma? Multiple myeloma is a plasma cell malignancy in which monoclonal plasma cell proliferate in bone marrow, resulting in overabundance of monoclonal protein, which is called M protein, resulting in destruction of bone and displacement of other hemopoietic cell lines. So what are the risk factors of multiple myeloma? Getting older. Most people are diagnosed in their late 60s. Half of the people found to have this cancer are older than 71 years of age. Only 1% of cases are people younger than the age of 40. Being male are more likely to develop the disease than that of women's. Being black people are more likely to develop multiple myeloma than are people of other races. Having a family history of multiple myeloma, having a sibling or parent with multiple myeloma increases the risk of the disease. Having monoclonal gammopathy of undetermined significance, also called as MGUS. Multiple myeloma starts as MGUS, so having this condition increases the risk. There is no way to prevent multiple myeloma. If multiple myeloma is developed, we cannot do anything about it, but it is really treatable. So what are the signs and symptoms of multiple myeloma? The signs and symptoms of multiple myeloma range from asymptomatic to severely symptomatic with complications requiring emergent treatment. Presenting signs and symptoms of multiple myeloma include the following: bone pain, pathological fracture, spinal cord compression from pathological fractures, weakness, malaise, bleeding, anemia, infection, hypercalcemia, kidney failure, and neuropathies. So how this multiple myeloma is diagnosed? Multiple myeloma is often discovered through routine blood screening when patients are being evaluated for unrelated problems. In 1/3 of the patients, the condition is diagnosed after a pathological fracture when it occurs, usually involving the axial skeleton. Examination of multiple myeloma may reveal the following: dermatological manifestations and pallor and anemia, ecchymosis or purpura from thrombocytopenia, extramedullary plasmacytomas, most commonly in aerodigestive tract, but also orbital, ear canal, cutaneous, gastric, rectal, prostatic, retroperitoneal areas. Musculoskeletal examination leads to bony tenderness is a finding of pain without tenderness. Neurological assessment, sensory level changes, that is loss of sensation below a dermatome corresponding to a spinal cord compression, neuropathy, myopathy, positive tinnial sign or positive Phelan sign. Abdominal examination may reveal hepatosplenomegaly. Cardiovascular examination may reveal cardiomegaly. What tests are used for detecting multiple myeloma? Serum and urine assessment of monoclonal protein, or we can use the immunofixation test for confirmation of myeloma protein. Serum-free light chain assay in all patients with newly diagnosed plasma cell dyscrasias, bone marrow aspiration and biopsy. Serum beta-2 microglobulin, albumin and LDH level measurements. Standard metaphase cytogenetics, fluorescent in situ hybridization investigations, skeletal survey, MRI, and the routine blood tests, which includes complete blood count, erythrocyte sedimentation rate, comprehensive metabolic panel, which includes level of proteins, albumin, globulin, blood urea, nitrogen, creatinine, and uric acid. 24-hour urinary collection of quantification of benzose protein is also in a diagnostic criteria. C-reactive protein, serum viscosity in patient with CNS symptoms, and or may be very high M protein levels detection. What are the complications of multiple myeloma? Infections. Having multiple myeloma lowers the body's ability to fight infections, bone problems. Multiple myeloma can cause bone pain, thinning of bones and broken bones, which is called as pathological fractures. Kidney problems. Multiple myeloma may cause problems with the kidneys. It can lead to kidney failure. low blood cell count called anemia. As myeloma cells crowd out healthy blood cells, multiple myeloma can cause anemia and other blood problems. So is there any specific staging of multiple myeloma? The results of test help the doctor to decide the multiple myeloma stage. In multiple myeloma, this stage range from stage 1 to stage 3. The stage tells the patient how quickly the multiple myeloma is growing. In the stage 1 multiple myeloma, it grows very slowly. As the stage gets higher, the multiple myeloma becomes more aggressive. In stage 3 multiple myeloma gets worse quickly. Multiple myeloma can be given a risk level. There is another way to say how aggressive the disease is. What is the immediate treatment given for multiple myeloma? Multiple myeloma treatment isn't always needed right away. If there are no symptoms, patient might be kept in wait and see observation mode. When multiple myeloma causes symptoms, treatment often starts with medicine. Treatment can help relieve pain, control complications, slow the growth of myeloma cells. Sometimes multiple myeloma doesn't cause symptoms. Then the doctors call this it is a smoldering multiple myeloma. This kind of myeloma might not need treatment right away. If the multiple myeloma is at an early stage or growing very slowly, patient might have regular checkups to monitor the cancer levels. So what are the treatments used to treat multiple myeloma? The treatments are of these following parameters. Targeted therapies. Targeted therapy uses medicines that attack specific chemicals in the cancer cells. By blocking these chemicals, targeted treatments can cause cancer cells to die. Immunotherapy. Immunotherapy is a treatment with medicine that helps the body's immune system to kill cancer cells. The immune system fight off disease by attacking germs and other cells that should not be in the body. Cancer cells survive by hiding from the immune system. Immunotherapy helps in the immune system cells to find and kill the cancer cells. Chemotherapy. Chemotherapy uses strong medicines to kill cancer cells. The medicine kills fast growing cells, including the myeloma cells. Corticosteroids. Corticosteroids medicines help control swelling and irritation called inflammation in the body. They also work against myeloma cells. Bone marrow transplant. A bone marrow transplant, also known as stem cell transplant, replaces diseased bone marrow with the healthy bone marrow. Before a bone marrow transplant, blood forming stem cells are collected from the patient's body, patient's blood. High dose of chemotherapy then are given to destroy the diseased bone marrow, and then the stem cells are put into the patient's body. They travel to the bones and begin rebuilding the bone marrow. This type of transplant using patient's own cells is called as autologous bone marrow transplant. Sometimes the same cells come from the healthy donor. This type of transplant is called an allogenic bone marrow transplant. Radiation therapy. Radiation therapy uses powerful energy beams to kill cancer cells. The energy can come from X-rays, protons, or other sources. Radiation can quickly shrink growth of myeloma cells. It might be used if myeloma cells form a mass called plasmacytoma. Radiation may help control a plasmacytoma that's causing pain or destroying a bone. So what is a CAR T cell therapy? CAR T cell therapy is a chimeric antigen receptor T cell therapy, also called CAR T cell therapy. Trains the patient's immune system cells to fight myeloma cells. This treatment begins with removing some white blood cells, including T cells, from patient's blood. The cells are sent to a lab. In the lab, the cells are treated so that they make special receptors. The receptors help the cells recognize a marker on the surface of the myeloma cells. Then the cells are put back into the patient's body. They can now find and destroy multiple myeloma cells. What is a bone marrow transplant? When the bone marrow transplant is needed. The goal of a bone marrow transplant is to cure many diseases and types of cancer. When The doses of chemotherapy or radiation needed to cure a cancer are so high that the person's bone marrow stem cells will be permanently damaged or destroyed by the treatment. A bone marrow transplant may be needed. Bone marrow transplants may also be needed if bone marrow has been destroyed by a disease. Does multiple myeloma treatment have any complications? Yes, they do have some complications like bone pain, pain medications, radiation therapy, and surgery may help control bone pain. Kidney damage. People with severe kidney damage may need dialysis. Infections. Vaccines can help prevent infections such as flu and pneumonia. Bone loss. Bone building medicines might help to prevent bone losses. Anemia. Medicines can increase the number of red blood cells and this helps to relieve ongoing anemia. How to prevent multiple myeloma? With multiple myeloma, there are no risk factors patient can avoid to prevent the disease. There is no known way to prevent the disease in those who have other plasma cell diseases. Thank you, viewers.